Imagine a condition that can hide in almost any part of your body, making it a true medical detective story to uncover. You might think of tuberculosis as primarily affecting the lungs, but it can actually spread and manifest in many other places too. Diagnosing extrapulmonary tuberculosis, which means TB outside of the lungs, is often more challenging than diagnosing pulmonary or lung TB. It typically requires a thorough clinical assessment, advanced imaging studies, and, critically, obtaining a sample directly from the affected body site for specialized laboratory analysis. The main reason for this complexity is that the symptoms of extrapulmonary TB are incredibly varied. They depend entirely on which organ or tissue is affected. For example, TB in the lymph nodes might cause swelling, while TB in the spine could lead to back pain or even paralysis. Unlike lung TB, where bacteria are often easily found in sputum or phlegm, the Mycobacterium tuberculosis bacteria are present in much lower numbers and are harder to isolate from other body fluids or tissues. This means doctors cannot simply rely on a cough to tell them where the infection is hiding. The body's own immune response can also make it difficult to distinguish from other inflammatory conditions. So how do doctors find it? First, they will conduct a detailed physical examination and ask about your symptoms and medical history. This helps them narrow down potential areas of concern. Next, imaging techniques like X-rays, CT scans, MRI scans, or ultrasound might be used to visualize the internal organs and pinpoint any abnormalities. But the definitive step is usually taking a biopsy or aspirating fluid directly from the suspected site. This could mean sampling a swollen lymph node, fluid from around the heart, or a bone marrow sample. Once the sample is collected, it goes to the laboratory for several key tests. Microscopy can sometimes reveal the bacteria, but they are often sparse. Culture tests are grown to multiply the bacteria, allowing for identification and drug susceptibility testing, but these can take several weeks. A more modern and rapid approach often used is nucleic acid amplification tests, or NAAT. These tests look for the genetic material of the TB bacteria, offering much quicker results, which can be a game changer for starting timely treatment. Sometimes, a specialist doctor known as an infectious disease expert or a surgeon is involved to help locate and safely obtain the necessary samples. Understanding that TB can affect so many different parts of the body highlights why a careful and methodical diagnostic approach is essential. An accurate and early diagnosis of extrapulmonary TB is vital for ensuring you receive the correct and most effective treatment. This proactive approach helps to prevent long-term damage to organs and supports a full recovery, allowing you to return to your best health with confidence.